Hello, it's our pleasure to have one more expert with us, Dr. Mashati. She is an interventional cardiologist at Apollo Hospital, Ahmedabad. Also, she is a course director for WCC 2023. Welcome you, ma'am, to WCC 2023, and kindly tell us briefly about your presentation that you're going to have today's evening.
Thank you very much for having me here. I'm Dr. Mashadi from Apollo Hospital, Ahmedabad. My presentation today was on leaving nothing behind, how to treat side grants with drug-eluting balloons. As we all know, drug-eluting balloons are quite a new entity which has been added to our armamentarium recently. And there are not a lot of studies available, but except we have a lot of registry data for which we can deal with side branches using drug-eluting balloons. So today I had presented a few of my cases that we have done, me and my team, we have done in Ahmedabad Apollo Hospital. And I had presented a case of dedicated side branch with drug-eluting balloon, a geographical miss treated with drug-eluting balloon, and small vessel disease treated with drug-eluting balloons. There was quite a bit of discussion also which went on because of that. That was in short my presentation.
Okay, so you talked about the drug-eluting stents. So what are the prerequisites or what are the indications where you go for the drug-eluting stents?
I'm sorry, it's drug-eluting balloons.
Sorry.
Now, the main indication which has been recognized is in-stent restenosis. Drug-eluting balloons are class 1 indication for in-stent restenosis. But there are lots of incidental reports and registries which show us that they can be used in side branches and in small vessels.
So, and what is the outcome data with all these drug-eluting balloons?
Outcome data has been pretty promising in this situation yet, but like I said earlier, it's still a new
evolving technology,
experimental phase. And there is a lot of data which is going to be published in near future, and there are a lot of registries also which are taking place. So in very near future we will have a lot of details on this, but as of now our experience is extremely limited.
Okay, so since morning you are here at the conference, what is about the WCC that you're feeling, because it is this time international way and it is on mainly interventional cardiologists that are going to have some interventional procedures and are providing us the feedbacks and the amazing inputs on the interventions. So what do you think on this International Women's Day from the interventional cardiologist point of view? What is the scope of interventional cardiology, being a female interventional cardiology in the near future in India?
Actually, I have been in this field since 1993. I've seen interventional cardiology grow in India.
Yeah, that's
We've been
great.
doing interventional cardiology for a very long time. And honestly, wherever I have studied and wherever I have worked, I have never been at a disadvantage because I am a woman.
Okay.
It's what I feel is it's the way you look at it and the way you take things forward. If you are an extremely competent person, then your talents will definitely be appreciated by your colleagues, your peers, your seniors and your patients. And you will definitely have them coming back to you. So the only thing is, okay, initially as being a woman, you have to work a little harder to prove yourself. But in any way, you're not a disadvantaged person. In fact, what I feel is women would definitely make better interventional cardiologists because they are more careful in what they are doing and the fine work. The woman can definitely lend a lot of finesse to the work that she does.
Yeah, I'm very sure in the last few years and in the next few years also, in the future also, the cardiologists, many of the female cardiologists who were not pursuing intervention, but now they will prefer to go for the intervention because there is no boundaries for the female as such, whether you are in intervention or whether you are in preventive aspect. So whatever they want to do, it's only their passionate and their skills that can.
I think the boundaries are more in our head than anywhere else. If you are determined, you can cross any boundaries.
Yeah. Thank you so much for amazing inputs. Thank you so much.
Thank you.